Hey everyone, welcome back to the channel. If you're new here, my name is Desmond, and today we're diving into something really important: corticosteroids. These medications are everywhere, whether in creams for skin rashes, pills for autoimmune diseases, or inhalers for asthma. But what are they? Why do we use them? And most importantly, how do they work in our bodies? Let's break it all down in a way that's easy to understand. First things first, what exactly are corticosteroids? Well, these are a class of drugs that are used to reduce inflammation and control various conditions like allergies, autoimmune diseases, and even some types of cancer. They're very similar to a hormone your body makes naturally called cortisol, which plays a role in managing stress and controlling inflammation. These meds are like a synthetic version of cortisol. So when you hear steroids, you might think of bodybuilders, but corticosteroids are totally different. They're not the muscle-building kind. Instead, they're used to reduce inflammation, suppress the immune system, and help treat a variety of health problems. Now, let's talk about some common examples you might come across. Prednisone, a very common oral corticosteroid. Hydrocortisone, often found in topical creams. Dexamethasone, used in both oral and injectable forms. Beclomethasone, often found in inhalers for asthma. These are just a few, but they all share the same goal: reduce inflammation, and each of them can be used in different ways depending on the condition we're treating. Alright, so how do they actually work? Let me walk you through it in the simplest way possible. When your body is injured or dealing with an infection, your immune system springs into action, but sometimes it overreacts and causes inflammation, that redness, swelling, and pain. Corticosteroids step in like a calm down button. They reduce the chemicals in your body that cause the inflammation. Now, like any medication, corticosteroids come with a list of potential side effects. The more you use them, the more you might run into some of these issues. Weight gain, especially around the face or belly. Increased blood sugar levels, which can be a concern for people with diabetes. Bone thinning, called osteoporosis, which makes bones more fragile. Stomach problems like ulcers or heartburn. That's why doctors try to use them for the shortest amount of time possible and monitor patients closely. If you're ever on them long term, you might be prescribed things like calcium supplements or a special diet to protect your bones. So, let's make this interactive. If you've ever used a corticosteroid, whether it's a cream, an inhaler, or a pill, drop a comment below. Tell me what it was for and how it helped. If you haven't used one yet, you might be lucky. But it's always good to be informed just in case. Now, when would you actually see these prescribed? Well, there are a lot of situations where they're super helpful. Asthma helps open the airways and reduces inflammation in your lungs. Allergic reactions for things like hay fever or severe allergies. Autoimmune diseases like lupus or rheumatoid arthritis, where your immune system attacks your body. Skin conditions like eczema or psoriasis. And corticosteroids can come in various forms: oral, topical, inhaled, or even injectable, depending on what's being treated. Now let's talk about long-term use. It's a bit more complicated. Corticosteroids are awesome for short-term flare-ups, but taking them for a long period can lead to some serious side effects, like Cushing's syndrome, which causes symptoms like moon face, thinning skin, and more. That's why doctors always weigh the benefits and risks before deciding to keep you on corticosteroids long term. If they do, they'll monitor your health very closely to avoid complications. All right, let's wrap it up. Here are the key things to remember about corticosteroids. They reduce inflammation and are used for a variety of conditions. They can have side effects, especially with long-term use. Doctors will monitor you closely to make sure you're not at risk for complications. Always follow your doctor's instructions on how to take them, and never stop taking them suddenly without consulting your healthcare provider. Thanks so much for watching. I hope this gave you a clear understanding of corticosteroids and why they are so important in medicine. If you found this helpful, don't forget to like, subscribe, and hit the bell icon so you never miss a video. And of course, if you have any questions, feel free to drop them in the comments below. Stay healthy, and I'll see you next time. Please subscribe, like, and share.